Well, as we reported earlier, from Kakamega to Kitui and from Mathare to other public hospitals, operations, virtually no public hospitals are paralyzed as the health workers' strike began this morning. Most hospitals remain deserted with no doctors and nurses reporting for duty, and most patients have been turned away and forced to seek alternative treatment elsewhere in private hospitals which are still operating. Now, the government yesterday failed to avert the crisis after the union official skipped a meeting called to discuss the medics' demands. In Nairobi, doctors gathered at the Public Service Club before they started marching towards Treasury to seek redress. And Sheila Sendeyo has been covering that process since morning. I know she joins us live. Sheila, where are you exactly? Have you gone to the Treasury, and what's happening with the strike?
Or rather to demand for the implementation of a collective bargaining agreement that they negotiated back in 2013. And they say this amounts to what they say is a total paralysis in the provision of health services in all the public hospitals. The procession started at the Public Service County Club just a few blocks from here. They marched all the way to Afya House. There was an incident here just a couple of minutes ago. There was a tear gas canister that was fired, but they have resolved it with the security officers that are still here at the moment. As you can see, the gates were locked. They had anticipated that the doctors will come in and they will try to make their voices heard in terms of trying to have the government listen to them and to pay them what is due to them. And right now they are marching to Treasury and they're going to seek audience there with the CS as well. We are on the trail, but just to bring you up to speed with what the details of this agreement are, the doctors are looking for a 300% increase in the pay rise. The nurses, on the other hand, want a 25 to 40% increase. I remember the court had declared this strike illegal, but the doctors say that they had 30 days. The court on the 6th of October had declared that this collective bargaining agreement that they signed in 2013 was a legal and binding document, and they had given the government and the unions 30 days to sit down and to iron out some of the outstanding issues. And they say that the 30 days had lapsed. They had issued a strike notice that lapsed today. It was a 21-day strike notice that lapsed today, and so everything they're doing is within the law, and they say they are within the law to go on strike so that their issues can be addressed. And they say this is a countrywide strike. It's going to be long and drawn out, and the only issues that they will listen to, or the only solution that they will listen to, is if the collective bargaining agreement is implemented in full and they are paid their money in arrears that was supposed to be implemented back in July of 2013. That is the 1st of July 2013, and that is all they say that will make them go back to work. So right now there is a team, we understand, that will be negotiating with the Ministry of Labour. There was a meeting last night involving Treasury, the Salaries and Remunerations Commission and the Ministry of Health, but the doctors say that they had so much time before this day to sit them down on a round table and to just iron out some of these issues, but they didn't take advantage of that, and that's why today they are going on strike. We will be following that, and we will bring you more details as and when we have them. But right now we are on the trail. They're headed to Treasury, and that's where we are headed as well, Ken.
All right, Sheila, headed to the Treasury building where they're supposed to meet the Treasury Cabinet Secretary, as other officials, of course, from the medical field expect to meet the Labour Ministry to try and find a solution. Sheila Sendeyo reporting. She'll be breaking it down a little bit later on.